going back to fatty liver, so Doc, can we elaborate it sa ating mga viewers? Pag sinabing fatty liver disease, what exactly is it po?
Well, our goal here is to talk simple and easy to understand. It's basically a condition wherein there is excessive accumulation and deposition of fat onto the liver. That's what it is, fatty liver disease. And because of that, two things will happen. One is that the liver will get inflamed. If you look at the course of the disease, the second phase, the liver gets inflamed. The third phase gets fibrosed or titigas. No?
Or nagpepeklat?
Yes, nagpepeklat. And finally, you will get what you have, the end-stage liver disease, which you call chronic liver disease already, which is liver cirrhosis. And the ultimate thing that we want to prevent here is liver cancer.
Oh, okay. So basically, hihimayin natin yan, Doc. So basically, hindi pala natatapos dito sa fatty liver per se. Okay, so marami siyang mga worst complications or worst consequences later on. But kanina yung sa unang na-mention yung Doc, no? So basically, there's increased production ba? Did you mention that? Or increased accumulation?
Well, it's the term that we use in English, no, in the medical field is called metabolic syndrome. Which basically means that the individual suffers from several factors. One is obesity, which is that's how you get the fat to come in, you know, it's deposited onto the body and onto the liver. Blood sugar is the range usually, and because of the obesity as well, in tandem with that, the cholesterol, which is what these people know about what cholesterol is elevated, and there is also lifestyle factors that deal with it, like specifically alcohol intake.
I see. Okay. So basically, ito bang fatty liver, Doc, may mga types din ito?
Yes, there's basically two separation. There's one wherein you only have fat deposition onto the liver, nadidepositohan ng taba yung liver. And if you move onto the other side, which is wherein you get inflammation, namamaga, you call that hepatitis. So you get fatty liver, and then you have fatty liver with inflammation.
I see. Okay, so and we have to reiterate lang na yung hepatitis, kasi minsan ang kalimitang alam nila would be yung viral, no? Yung
That's
nakukuha
correct.
na from the hepatitis virus. But this one, pwede pong mamaga ang liver, okay, secondary to fatty deposits. Okay,
Yes.
fat deposits. Okay, and ano eksaktong cause ito? I mean, you mentioned about having hypercholesterolemia or mataas ang cholesterol level. So with that, Doc, ganong katagal yung level na mataas ang cholesterol before may studies ba na nagsasabi na before siya mag-manifest as fatty liver already?
Well, I'll answer that by saying the hepatologists here in the world, and also specifically here in our country, are saying that fatty liver disease is about prevalent in about 36-35% in the world. The age range wherein you get it, if you're interested on how long before you get it, seems to be getting younger and younger. Here in our country, they estimate that it's about 20% of the people have fatty liver disease, which wasn't really the case before. So now we're seeing it more and more, and the basic problem that they're saying here is it's not really being truly recognized because there's one factor that prevents that. Fatty liver is usually, most of the time, painless. You don't feel anything.
Unless nagkaroon na ng hepatitis or pamamaga later
Well,
on.
you can have a little inflammation in the liver, and then you can feel something. But for most cases, no, there's no symptoms, so people won't have it checked. So there should be some awareness, some advocacies that should be done about it to make the people aware that there is this, we call it silent type of disease, fatty liver disease.
So does it suffice to say that when you see the patients who suffer from fatty liver, usually nasa mga severe stage na yan?
No naman. Usually, the reason kung bakit sila pumupunta sa doctor is because of a blood test that they are usually asked to do. And the name that it's called, well, I'll just abbreviate, is the ALT. It used to be called SGPT, if you're familiar with that. And they get that blood test from their doctors, and they see that it's elevated, and then they start testing. So
that's when.
That's
so,
when.
Okay, so parang basically, papasok dito na incidental finding yung dito sa fatty liver.
Yes, because you don't feel anything eh.
Yeah, okay. So, pero sometimes nga, mas maganda pa rin pag may pain eh. I mean, generally speaking, kasi it signals that there's something wrong, okay? Pagka merong pain, meron siyang sinisignal na, so there's something wrong and mas maaayos ng patient. So anyways, because of an elevated liver enzyme, just like what you said, yung SGPT po, no, dahil mataas siya, so nagsa-start na nga ng workup ang patient. Okay, and di bale, Doc, we'll get there sa mga diagnostic measures later on. Okay, and apart from increase in the cholesterol diet or fatty diet of patient, what other risk factors yung meron po that can put the patient in this condition?
Yes, it also includes, usually the profile here is that there's hypertension, there's an elevated blood sugar, no? And then as we mentioned, yung cholesterol nga is mataas, no? And then usually their lifestyle is that of sedentary, okay? And their diet that they take is the very fast food, milk tea, quick fix, poor nutritional value food that because of the fast pace of our life and limited choices in the grocery, no? When I say limited, to eat healthier can be sometimes more expensive. Eh. It's cheaper just to eat the regular, oily, low nutritional value food. Eh. And then that pushes you, all those factors, hypertension, bad cholesterol, high blood sugar, lack of exercise, that all leads to create this silent epidemic.